with a specific focus again on the research enterprise at universities. So important to note for this webinar, the content that we provide during this webinar is current as of today. Each panelist will go through their specific talking points and examples on how they estimate cost and losses. And of course, this can change quickly as we move forward during this time of COVID-19. All of the, we're recording this webinar, and this webinar can be shared with others after today. We'll post the webinar on the website, on APLU's website, and we should also have included a link to YouTube as well to easily share. And again, these materials today are just for the discussion to share and to understand and educate ourselves on how we're doing and how we can do better. So we're always looking for feedback, and this being a conversation. To participate today, we're going to try some different ways of managing the questions, the chat, and having feedback once we reach the Q&A session of today. So at the bottom of your screen, you should see the Q&A icon. You can ask a question at any time as the panelists are talking or even afterwards. Please make sure that you use the Q&A only for questions. So your statement should end in a question mark, and that will help us understand what we should be asking the panelists to remark upon. Also, you can use the thumbs up icon to upvote a question, and that will help us prioritize which questions you want to ask first or have answered first. We are also going to open the chat function this week, unlike last week. The chat function, again, is only for everyone who is attending to talk to each other and have more of the side discussions. You can also use the chat function to notify us, the facilitators of the webinar, if you're noting any technical issues. We won't be using the chat to monitor questions. So if you have an actual question, use the Q&A, please. And then again, once we get towards the end of when the panelists have their remarks, then we will try and use the option of raising hands, because we want to try to have a more two-way discussion. So we'll start asking people to respond, or maybe to ask for more clarification in whatever questions being asked, or if you raise your hand, we'll be able to see that as well. And we will provide a link to today's slides in the chat window, so you'll have access to the actual files as the panelists go through their presentations. I want to give a special thank you, of course, to the members of CORE. You guys have been a wonderful and engaging group of people who are asking great questions and really leading the charge on how campuses are responding to COVID-19. So thank you for being a part of this and being a part of helping your campus reopen and finding the best ways forward. Also, a special thank you to David Kennedy from the Council on Government Relations. He's been helping provide feedback and consulting on how we can have this type of discussion when we talk about the specifics on the finances. Also, special thanks to APLU staff for helping produce the webinar. We're always learning and trying to do better. So Winston, Kaylin, Elijah, Tia, and Casey, thank you so much for working on the back end and helping this happen today. So without further ado, I'll turn it over to Chaouki, who will be moderator today. And then we will have Tanju and Ram speak about their individual approaches to this question on estimating cost and losses. So Chaouki, if you would like to begin.
Thank you, Bethany, and thank you, everyone. Good afternoon for those of you on the East Coast, and for all of our colleagues on the West Coast, good morning, I guess. And this is, hopefully, it will be one episode of what I'm planning on having, maybe the cancellation of the COVID-19 season. So hopefully this will be the last time we will have to go through all of these things. But we have two panelists in here. We have Ram and Tanju, and we're going to start with Tanju and go with Ram afterwards. And they each have about 15 minutes to describe what they've been up to at their respective institutions. I hope that we'll all learn from them, and please, at the end, they're going to have some questions for us, as well as for us to be able to ask them questions. So with that, I'd like to pass it to Tanju, our colleague from Clemson University.
Okay. Okay. Oops. Okay, this is now, I need to arrange my slides. Okay, I think, let's see. For some reason, I have dual screen. I see, okay, I'll use this mode. I think that's good enough. So good morning, everybody, or good afternoon. As Chaouki said, my name is Tanju Karanfil, Vice President for Research from Clemson University. And today I will be talking about the COVID-19 impact analysis that we are making on our university research enterprise. For those of you who are not familiar, Clemson is a land-grant university at South Carolina, and we do not have a medical school. We are a science and technology and agriculture school. And I get interested in this topic because my CFO approached me about a month ago and asked me to develop a model to predict the impact of COVID-19 on our research enterprise. He did the same with academic affairs, athletics, and so forth. So that was a trigger for this exercise for us. And also he said he wants to see this model, in fact, to be flexible, analyze different scenarios. So that basically set our objectives to develop a financial model for the assessment of the COVID-19. And also the model should be flexible enough to develop different scenarios. Now, one thing I would like to emphasize, this is something that we intended to do for internal use only. I never envisioned to share this entirely with the public, but then when Bethany approached me, then I said, well, we have 100+ smart VPR colleagues around the country. I can definitely use their feedback. So therefore I volunteer to share this information. And also, this is a work in progress. So it's not complete. So we are still working on it. So we will really appreciate your comments and feedback. Now, the model has these guidelines and assumptions. As I said, it covers the university research enterprise, not academics or athletics. And the parameters that we have here, we determine this for Clemson. It can be different for different institutions. And also we try to pick the major cost categories. We collect the data, as we are going to see, based on the Clemson's accounting and management systems, although some of the data that are come from also from uniform databases like NSF, Earth survey, and so forth. And also, we, although make projections, we collect the actual expenditures data for the model parameters and continuously check the model with the actual numbers to make adjustments. And also the intent is not to find the solution for this cost. We are just making an inventory of this cost. And once we know the amount, we will be able to hopefully find some solutions. And finally, maybe some of the parameters may lead to an aggregated data set uniformly adapted by the institutions, and if aggregated together, can be further used to justify some of the congressional or federal agency requests that we might be doing in future. What are the model parameters? Well, the first item is the payroll charges for personnel on the sponsored projects with low or no productivity. At Clemson, we are operating currently about 30% of research capacity. So we have about 70% of the research personnel do not have access to campus. Since we have as fiscal agent responsibility to the sponsor to deliver the work, we can be asked to basically provide resources to complete the work successfully, even if the sponsor forgives some of the work, because they might be grant, so they might forgive maybe some of that, or they might accept a reduced scope. still faculty or grad students would like to complete the work for their career goals or for their scholarship and so forth. The second model parameter is the replacement cost for some expired material and supply during the closure periods, and also for some of the donations that we share with outside of the university, such as PPEs and reagents. Third parameter is unreimbursed cancellation expenses. Especially at the beginning, there has been several travels and conferences canceled, and this is still being processed, but we are hearing some unreimbursements. Fourth model parameter is repair and recommissioning costs for research infrastructure, such as equipment, instrumentation, some animal models or cell line reduced, needs to restore, and so forth. Fifth parameter is the cost associated with the research ramp up, extra cleaning of research space, distributing additional protective gears, rehiring, retraining personnel, and so forth. Sixth parameter, as we now also do some application for COVID-19, which is an extra workload, there are some administrative costs that we identify in a few colleges that might require additional support. Especially there are some modifications, some submission deadline, create some bottleneck for research administrative support. And the seventh model parameter is the unknown nature of the international student coming in the fall, because we have about 600 acceptance out there. And I was talking with our graduate school dean. The number of the students requested IS 120 is 50% lower at the same time last year. So of course, if these people cannot make it, some of the PIs have already been asking me, can I hire a postdoc or can I put a technician to get the work going on, but I don't have enough money in my budget. So can I find some extra resources and so forth? And we edit this because of that request. And also a model has some loss parameters. There are a number of units, at least on our campus, generating revenue, and this revenue covers some expenses such staff, supplies, and so forth. These include core facilities. We have some departmental service unit providing services to industry, field trials, reduction in the commodity sales. So there is a number of areas that can cause loss of revenue during the COVID-19. Of course, termination of contracts and service agreements is another concern or in another area for potential loss of revenue. And finally, unreimbursed tuition due to low or no productivity on grants and contracts, or the grad students unable to travel to US due to travel restrictions, because we have also a number of self-funded international students coming to our campus, and therefore, if they cannot come, it's a loss of revenue. In fact, for those of you who are familiar, the annual international student revenue of the higher education in the United States, I think, is estimated about $2.5 billion. So interruption of that pipeline definitely will impact the higher education. So with that, this is how our model cover or summary sheet look like. Each of these model parameters has their own worksheets that where we make several assumptions for each of these model parameters. On the right side, you see the data sources from where we get the model parameters to make projections. We look at our last 3 years of data, FY 18, 19, and 20. Our expenditures have been relatively uniform for us to be able to make some assessments. Some of the data come from survey from colleges. Some data come from the CFO's office or our emergency operations center, and so forth. And also the model has some information that for us to think about. So I'm going to tell you about the bigger picture later, but we also dive into the payroll, because payroll in our case turned to be a major potential source of the loss or we need to come up with. Therefore, we look at payroll closely, and this data shows us Clemson's annual expenditure for FY19 per $100 million expenditure normalized. What you see here, 33% of the expenditure was in payroll, 9% is fringe. So the half of our research expenditure basically almost is on the payroll side. The material and supplies 9%, subcontract 14%, travel 3%, and so forth. Same thing in 2020 until the period where we went to modify operation. The number was very simple, or very similar. Then we look at our CFO ask information in two ways. One is during the COVID closure or modify operation period and summer, because some of you, and we are also ramping up, and also for fall. Therefore, model has different parameter for the summer or partially spring and summer period between April 1st and September 1st, and different parameters for the, but what you see, again, payroll is half of our expenditures. We also look at this data a little bit closely in the payroll on an agency basis, because if agencies provide some supplements to cover the gap, that's great. But if agencies do not cover the gap as supplement, we would like to see how much payroll is distributed across the different categories, so we will know that. And same thing for USDA and Department of Energy. So therefore, we can make some assessment based on if agencies go and develop their guidelines separately. We also compare the federal versus non-federal in terms of our payroll exposure. And the only difference that we noticed, we have more staff and technician working on non-federal grants compared to our federal grants. So back to our model. So when I look at this model for April 1st to September 1st, I checked this morning, these units are feeding this. Our worst case scenario for this 5-month period can be up to $35 million. So we are looking at approximately $6 to $7 million per month as the worst case scenario as if right now. And then from here, we are looking at different scenarios, how this might be covered maybe through some CARES Act or new version of the CARES Act or some agency decisions. Now, you can also, you don't need to go that granular. Since the payroll is the major category, if you want to really make a simple back of envelope calculation, maybe like payroll, supplies, cancellation, termination, and tuition, if you have your FY19 data, in other words, without doing too much survey, if you reduce your model parameters, you can come up with another estimate. Finally, for the fall, as I said, the model parameters changes because we are not going to have cancellation charges, hopefully no more ramping charges and so forth. So we reduced the parameters from, I think, 11 to 6, but then we are analyzing 3 scenarios. If we have a regular campus operation, business as usual, if we have a hybrid, like partial research, online education, or much more restricted situation where we have only critical function and online education. So this is a very quick summary of how we approach this. I really look forward to hearing your feedback and also having a good discussion. I'll turn back to Chaouki.
Okay, you want me to start?
Yeah, would you Ram, please?
Yes.
Go ahead.
Okay, let me share my screen here. Okay. Can you all see the screen?
Yes, thank you. It seems to work.
Okay, great. First of all, thank you for inviting me to share what we are doing at UVA. Similar to what Tanju said, the question came from our Chief Operating Officer's desk, asking for, and the provost asking for what is the institutional loss. I mean, we're looking further down to eventually what's going to be a delta that we're not going to have any coverage on. So that required making several assumptions on federal reimbursements possible, supplements possible, etc. So the approach that we took is an estimation approach, where we looked at, first thing is what we did similar to what Clemson did, what Tanju did, is first look at monthly expenditure data and look at its components. Okay, and then looked at what our current state is, and do we see any difference at all in any indications at all? And we knew the answer that I don't think it's too early to see any differences in spending pattern. So then we had to, so the next step is two approaches. One is ask the PIs and go through granular expenditure data, etc. And asking the PI was too early, so they would not know either that how things are going, because they have sent students home, or postdocs or employees home, and they continue to pay. They have money in the grant. So that was the bottom line. So then what are the best and worst case estimates? So in order to do that, so this is pretty much the same set of components that we contemplated and included in sort of a estimation effort. The first is we know that we are compensating graduate students, and some non-designated personnel work without pay. And some PIs told me that they bought several reagents and supplies that we call sunk cost, that they said, well, you ask us to go home 6 weeks, I have to come back and buy the same thing again. And the grant, I've already spent money on the grant. So that's a sunk cost that we have to keep. So materials and supplies pretty much stood out as a component that we should be more aggressive about reimbursements or replacement values higher. The third is recommissioning costs, including some faculty said they had a whole type of transgenic mice that they have to euthanize and start all over again. There's a cost associated with that. Some folks had cell lines that they had to freeze and restart. So there is, given that we have a medical school and it's very medical school research heavy in terms of our portfolio, these things really stood out. In one of the grants, for example, one of the R01s, they said they spent $50,000 in developing this particular disease model in mice, and they had to euthanize and start all over again. In addition to lost time, we looked at lost replacement of materials and supplies in these cases. Then the same concept, when you bring back in personnel, they're not going to be productive from day one. So you get a lower ramp up period where they are setting up the labs and getting things going, but they're not productive in terms of the science. So that we had to account for that. And then support costs for graduate students. Now we have, there are certain types of, for federal grants, as we all know, that there is a discussion and there is this $26 billion bill that looks promising. I'm hopeful. But for industry related work, there is no such thing. We have had several industry partners say that they don't know what their finance will look like. So uncertain, no one has reneged or not paid our bill yet. But we do expect that we may not be able to get money. So in those cases, working with the provost, we clearly have this idea that graduate students are students first, and their education comes first, and this project is a means for supporting them and working on an idea. But if that falls through, we still have the obligation to support the student. So we have to find money for that. Then this last piece is because if these are F&A related to all of these, our labs did not shut down, the buildings did not go down. So we are continuing to spend monies that are associated with F&A. So we add all of those numbers, and the lost revenue, I put it in red because we have not gone to establishing what the future losses and immediate losses in revenue will be and how to account for that. We did not have a plan, or at this point a need to add that. So the key question was, if we keep the PIs out of the labs, how much are we going to lose, and so on. So with that, I'm going to walk through a set of, I'm going to show our split. These are our categories. So there's faculty salaries, contractual services or central services that people do microscopy work and all of those kinds of, that charge us to contracts, including our per diem, animal support, etc. Then we have equipment, graduate teaching assistants, research assistants in this case, and healthcare services and so on, scholarship fellowships, teaching, research assistant expenditures. And then you have travel, and in the travel, as Tanju said, there were documented cases where they signed up to go to a conference, the conference got canceled, the non-refundable ticket. I think some of them have allowed to hang on to the ticket for a year or some things like that. But we consider that lost for just for the purpose of these calculations. And then you have additional university staff being charged to the contracts, F&A and so on. And we have some classified employees, which are state employees charged to grants. These are staff working in labs. So when we look at this chart, this is the first column. You probably cannot read it. This is normalized for $100 million in research expenditures. So if you look at this, the first column is fiscal 19 July, and then second column is just July fiscal 20. So we try to compare, and the months of concern is right here. This is March 19, and right next to it is March 20, right there. And they looked identical. So we have no impact seen in the research expenditure data, and April is building, and I don't have the current data yet. So this is, but then what is important here is that the mouse I parked on is materials and supplies. So we have a sense of materials and supplies 2 years in a row in this month, as opposed to material supplies somewhere here, early on in August when PIs seem to buy a lot more. And then these are salaries, faculty salaries directly. And these two orange small rings here, these are graduate student stipends. So we had a good sense of the stipends, materials and supplies, and then the salaries as a whole that we could do, and which I think Tanju displayed in his data in a pie chart. But we used this. This was, so basically we estimated that about 10% of materials and supplies in the monthly research expenditure that we should consider aggressively lost or to be replaced. And then salaries depends on what the federal allowances will be in terms of supplement. So that's sort of the gist of how we looked at this data and then took some of these parameters that would go into a model. So here are the observations. 10% of total expenditures in materials and supplies, 90% is primarily salaries, tuition, travel, all of those other things, except this material supplies, obviously. So then we wanted to run a best case example. So we took a month, we said, okay, if a monthly research expenditure is 25 million in federal expenditures and 8 in non-federal expenditures, given that scenario that we see that non-federal is more likely we're going to lose more in non-federal versus federal. So the assumptions, next line, basically what we have here is 50% of the research expenditure is for actual work that we actually did and completed and so on. So we're not going to ask for reimbursement. That's money spent as per plan. So take the remaining 50% and then say that 95% of that 50% is reimbursed one way or the other by, this is the optimistic approach, by federal agencies through supplements, through allowance of salaries, and so on. That's the best case. Now, for non-federal, we assume, these are numbers, by the way, this is algebraic calculation. There's really not a model that needs iterations or anything like that at this point. I would even characterize this as back of the envelope calculation if you want to simplify it. For non-federal, we said only 25% of the unproductive half is reimbursed. So this abrupt drop by non-federal sponsors to say, too bad. And then this is optimistic, saying that 25% of that will still come through, right? For materials and supplies, I think 50%, we're sort of mid-year, 50% loss for the month is something that, a more aggressive number that we put in regardless of federal reimbursement or not. This is likely to be difficult to reimburse. And considering that materials and supplies is 10% of the total, so when you look at the calculations, basically saying that, for example, 25 million, half of that, and 5% is not reimbursed by federal. And 8 million, half of that is 4, and 75% is not reimbursed because 25 is reimbursed somehow. And then all of that is weightage of 0.9 because material supplies at half the loss is weighted 0.1. So that's it. And came up with a number about close to $5 million a month. This is institutional loss, assuming the federal government would actually cover the cost and we have no means. This may be manifesting in the form of if a PI comes and tells us that I have a graduate student, I spent my money, and now I want to continue the degree, I don't have money, we know where that would belong, would be would most likely belong in this part that the institution may have to invest to support these students in some form or the other. So the worst cases scenario is the next slide, where I simply change these numbers. That's it, same formula. 75% of the remaining expenditure is reimbursed by federal, 25% is not. And then sponsors pretty much go dead, zero, non-federal goes zero. No more money, beyond what has been charged and billed, which is, I'm assuming it's half, about midpoint in the year. Material supply is 50%, but when it comes to the industry material supplies, it could be more. But I think I didn't take that granular detail, but 50% loss. When you do that, our estimate came out to be about $8.5 million per month. That's institutional portion. So that's the gap. So now we are thinking about mitigation strategies. For example, the reason why this is $8.5 million is this would be, you continue to work on non-federal grants, although they said zero. You continue to deliver on that, which I think doesn't make sense. If there's no money, you only focus on the student to pursue their degree and work on the academic component of it. And so that we don't actually run all the experiments in the way we would have done if the industry had provided the money. So the last, this is, although we say 8.46 million, that's sort of the worst case, that we continue to deliver all deliverables. Same thing may happen with federal agencies. They may say that, well, we're not giving you money, but we're also asking you to change your deliverables, your milestones, and your scope of work, rearrange it, but we're not giving you any more money. Then that relieves the students and the faculty to pursue other projects in that time. So all of those nuances can be taken into account, but first cut is something that we had to do like this. So I think that's all I had to kind of give you a sense of how I responded back to our leadership provost and the CFO as to what our estimated institutional loss might be. And that's, I want to stop here. And I want to switch this to this next slide and then have Chaouki take over from this point. Chaouki?
Okay, thank you, Ram. So we have some discussion topics here, basically to hear from you. And I know that Bethany also has some of your questions. So Bethany, would you like, okay, you're getting some questions, but let's start with this. First of all, and please use the guidance from Bethany at the beginning, to raise your hands and so on. But do you agree with the assumptions? And if not, what else would you include, and what else would you take away from that? So why don't you read through these? We're going to leave them in here, but basically, really we're looking here for your feedback as well as to have a conversation, and then some of your questions we will answer as they come in. So with that, Bethany, the floor is yours to try to guide us about either questions or who has some comments on these.
Yes, thank you. So we'll leave this slide up for discussion topics and these questions. And again, we're trying to do a two-way chat. So if you would like to respond to any of these discussion topics, do you agree with these assumptions? Do you have a good idea of ongoing research on your campus? Are the categories of expenditures for you different, more or less granularity? Can we agree upon a standard set of categories? If you would like to respond to any of these specific questions, you can raise your hand. Again, there's an option, should be at the bottom of your screen, to raise your hand, and we'll try and respond or call on you to talk and respond. But we're going to start with questions. One of the first, again, you can upvote a question if you think it's really great, and we'll prioritize that in our list of questions to ask. One of the first questions came from Carl. Just to clarify for Ram, the $8.5 million loss is based on a total budget base of 25 million or 100 million?
Let's see. Well, this is an assumption here. The data that I have here is normalized data, but here I used an actual data that's 25 and 8. So these are not normalized to the 100. So this is not, 8 million is not part of the 25. That's what Carl is asking. 25 million in federal, 8 million. That monthly expenditure is 33. So So yeah, this is not, don't mix this with the normalized portion is only to get a proportion, but these are specific.
Ram, clarification is, so is the 5 million at the bottom, the 4.9, that's out of the 33 million per month, correct?
Correct.
That's not per 100. Okay. So the worst case scenario, the 8 million plus, that's also out of 33 million.
That is correct.
Okay. Thank you.
Okay. Some other questions. Again, if you want to respond, please raise your hand on Zoom. Another question from Joseph Gladden. How are you estimating productivity loss? And I think that both Tanju and Ram could answer this question. So Tanju, do you want to try first?
Sure. In our case, we have a list of the faculty and grad students access to campus. And also this is related to the grant activities. In other words, we know the people funded from each grant and how many of them have campus access and how much access that they have. And also they will eventually later certify their effort basically. So if we are gonna go and then compensate at the end, probably it's gonna be a combination of effort reporting, certification, and or a survey with the faculty compared to how much access they were provided in that grant and how much productivity that they were able to accomplish. So we are not putting a fixed number, but at least we know grant by grant who on those grants have been given access and how much time. And then we can compare this with the faculty certification or faculty claim, basically. That's why the number that I put together was the worst case scenario, that what we are looking at, and then we will go down from there to based on the faculty disclosure of their productivity, basically. Ram?
Yeah, in our case, the productivity assumption is we had 50%, and it's an assumption based on when you talk to the medical school researcher, this is sampling based is what we came up with the 50%. Several labs have strictly postdocs and staff, so they're operating pretty much key personnel, and they're operating well. And for engineering, it's all graduate students, and they are shut down. So we looked at so it's on the high side, but it's a 50% on the medical side is a reasonable assumption is what we looked at. And talking to other institutions, in fact, the California document that Randy put up at 15 the phase 1, it talks about 15 to 35%, and most institutions are probably there. And looking at data from Clemson, it's in the ballpark. So it's sort of it's an estimate at this point, but we are also developing a survey of PIs to sample PIs in different domains, and then make a more informed estimate later on.
Okay, thank you. Continue again the questions in the Q&A, and I think that we have someone who has raised their hand. Jerry Blazer, I'm going to click a button that will allow you to talk. This is our first time trying this. So you look like it says talking permitted. Give it a try.
Can you hear me?
Yes, we can hear you.
Hey, Ram, we're thinking of surveying PIs. I'm just kind of curious what kind of questions you're going to ask them.
Yeah, I can. I don't have that in front of me. I can, if you shoot me an email, I will. They send you the one of the questions we are asking. That's at a PI. When you go to a PI, it's a grant by grant. That is, then you ask the and student by student. So if you had a graduate student, we ask that for the salary that you paid this month, what proportion of this work was done remotely by the student, and what proportion was not, what was paid without work. That kind of question. So we have questions in that term. Materials supplies, the question at this point when we ask the PIs, because the source of knowledge, I think that it's at best at the PI. So one of the things that we are doing as a principal, I'll send you that list of questions. but the source of not a question, the nature of question we're asking is, we are setting this date when we actually went down, that is May, I think it's March 17th or something like that. On that day, things that you purchased, for example, materials and supplies, that you will have to repurchase. So it's not something that you did afterwards, something before. By that day, what was the inventory and how much of that has gone to waste by the time you restart? So we kind of setting these two dates and then ask people to think in that format so we get a better handle on it. Yeah, but we have a set of questions that PIs have to answer that they have to share.
Okay, thank you. I'm glad that allowing you to talk, that feature worked. So appreciate you retesting that. So in the Q&A, I'm gonna ask Sam Bentley's question first because we saw it first, but then I see also Richard's question has been upvoted also. So we'll ask Sam's question first. Why not also include the value of faculty time that is state funded in addition to grant funding? That is also an important loss of productivity when remote. So I think this could be answered by both panelists.
Let me start. Maybe our state, portion of our portfolio is very small, and then we are making these big assumptions: 75% from the federal versus 95. So we're dealing with big numbers, and this probably the state would be lost in the noise. So we're not. That's why we simplified the model rather than go too granular, but have this higher level view of what's going on. That's the only reason.
Same for us, Bethany. Same thing. I don't think we have a larger state-funded faculty, so that's why. But it's a good idea. I'm going to look at it a bit more closely. But that was the main reason.
Okay. I also see Rao's raised his hand. I'm going to hit talking permitted. Unmute to make sure we can hear you. Okay, you should be.
All right. Yeah, so this is Sriram Rao from VCU. And so one of the questions I had, Ram, and for both or all three of you, the variables are going to be widely different between biomedical versus medical. So would it be helpful to have two sets of variables, or have you considered all of that and felt the way you have projected that it's fairly standardized across all fields of research? Because several schools don't have medical schools. So just trying to see how to factor that in projections.
Yeah, maybe Tanju, you want to start?
Since we don't have medical school, our data represent non-medical school situation. But since you have both, Ram, have you looked at two separately, medical versus non-medical sides?
No, ours is unified. Now, one big difference that you will see, Tanju, since the proportion of graduate student support is significantly higher for non-medical school, which we see our subset of engineering is significantly graduate student support. Pretty much all research is done by grad students. Whereas in medical school, it's a postdoc culture and the staff culture. And so when you really look at the numbers, you're going to be seeing the differences between the two types. It depends on, and again, the productivity, like I said, the medical side of school, because of the staff and the postdoc culture, it's more productive under these circumstances than graduate education centric disciplines. So this is an overarching average of overall in a sort of average, but when you ask the PI level granular data, that's when you're going to be able to peg a different efficiency for these two types of research. But and again, the reason I was excited was Tanju's talking about the school without medical, and ours is very medical school heavy research portfolio. So if you, and the proportions do show that our staff salary is significantly higher, and the faculty salary in academic year is significantly higher because of the NIH type funding.
Okay, thank you. Then again, moving on to Richard's question, it appears that these models assume either 100% normal operations or 0% remote operations. How do you estimate the level of productivity and loss when people are working remotely and still partially productive? So I think we are all kind of answering this, trying to answer this question in relations to the metric of productivity.
One way we are approaching to collect that information on the certification report, since we do electronically, we have for each line item, we have a comment section. So therefore, before running the reports, we are planning to ask or at least we are considering to ask the PI the level of productivity for the amount that they are certifying and if they need any support or not. So we haven't decided whether we are going to run separate survey or we are going to use electronic data collection for certification at the first run to see where people are in terms of their productivity, because absolutely some people are working remotely, but they are doing modeling, writing papers. And also the other thing to put in the context, at least for Clemson case, we have been really modified from the end of March to now. So right now we are ramping up. So we are looking at really 2-month periods and until we will recover. So really we should put in the context, because if a grant is 3-year or 4-year or 2 years, how this period affect the productivity in that grant. And that time may be used for beneficial things like papers, publications, or the reports and so forth. So we are thinking maybe using our certification tool to collect that data and then to make an assessment. Again, that's the current discussion. We haven't decided, but that's the discussion.
Yeah, and same here. I'm working with all the associate deans for research to talk about a survey, and one of the schools has already done the survey, asking again the notion that the PIs know best if their students are productive, if in a graduate student culture, to what extent they're productive. And the other part is the idea of when you want to ramp up, there is a strong pressure on students who are close to finishing. They're very productive. They're not able to. Those need to be in the lab. So as we let people back in, the early entrance to the lab are the ones that may have had the most impact on their productivity. That's why they're coming up first to get in. So that may be there's an indirect measure that I'm hoping that we'll get some data from that. But it's coupled with the ramp-up process.
All right. Yeah, again, keep the questions coming and feel free to raise your hand and offer a response to what the panelists are talking about, or answer the questions again on the screen in the slide here. So we are doing our best to manage any type of technical difficulties with registration, and so others I think have somehow joined a different Zoom meeting, but we still are able to see your questions. So Ramesh is asking, if you are, we are looking at quantifying the loss of research revenue for graduate students and postdocs and associated future costs. Line is resulting from extending their studies by 1 semester, even if the duration of shutdown is less than a semester. Is that a reasonable approach? So how are we thinking about students and grad students and sort of extending their time? Any thoughts on that?
Well, as Tanju said, it's a 2-month ramp down, and or 2 months in the low performance space, and as we ramp up, the 50% or so efficiency should lead to the loss is basically the additional money that we need to do the work, but that's not covered. So that's the way we are looking at it. So it depends on how much of the supplement actually covers the graduate student cost. So it's not if the question is, do we ask for 1 semester support supplement from the agency? That I do not have a feel for. But if we look at what the reimbursement would be, then the difference is what we think is the support cost that additional cost that we need. Tanju?
Well, I think, as I said, we have a list of the personnel who have access to campus, so at least we know their ability and how much time. So we haven't done, again, in-depth discussion about how we are going to cover 1 semester or so forth, but because of that data set that we have, probably we will go and look at case by case, those who don't have any access and have low productivity and PIs and they make a case compared to someone has partial access and so forth. So again, as Ram said, like maybe 2-month down period and so forth. So I don't think we are gonna make a blanket like 1 semester to everybody, but we will try to go. And of course, we will also pay attention the the need of the student, the branch, and so forth, and also how much money we can afford to. So we haven't come to that level of detail to develop a policy or a decision who and how much we can support, basically.
Can I interject something here, Bethany? So part of the loss is also time, and some things cannot be recovered. I mean, this exercise here is looking at the financial impact as much as anything else, right? But in another discussion, we had colleagues bring up the point that our faculty in the humanities or the performing arts and so on, that time that's lost is because they only can do certain things in a certain time of the year, so the summer or the fall or whatever. So if you had a performance schedule and it's gone, that's gone. So I think as we develop these things, we need to keep in mind that as much as we're trying to look at the financial impact, we also have a time loss by graduate students and by other faculty, and that's never going to be made back. So, yeah.
Chaouki, that's exactly eventually, I truly believe that the institution will be affected. We're going to have to spend some money from our pocket exactly for that reason. So that was the motivation for us to calculate our numbers to see what would that be, that we, again, a semester extension and a student, but the sponsor is gone, the student is here. That's the cost that, the best and worst case numbers that we have come up with that the institution needs to plan for.
Okay, I wanted to offer, Matt had raised his hand. I have clicked allowed to talk. Thank you.
Yes. Hey, it's Matt Tarr from the University of New Orleans. I just wanted to add to the question and the responses. If you look at the U.S. growth rate of this disease over the last month, it's almost a perfect linear correlation. There's no evidence of slowdown, and this is in shutdown mode. So we're going to have to deal with this for many months to come, or years. And so when we're thinking about the cost to research, we not only have to think about the shutdown time, but we also need to think about this recovery time period. And I think that's going to impact graduate students more than one semester.
Mm-hmm. Yeah, that's a good point. Yes. Yes. And I will add one thing to that comment is that, like, really the international students' ability to come, because they is an important part of our, R&D, and really their ability to take their visa to travel, and this includes postdocs also, to arrive on time, and then so that's one area that I worry that there will be some loss of time and effort just because we don't have enough workforce for all the research projects to be done or to be performed. So that's another area that I think we will face going towards fall. And that's why, like from where the resources come from, maybe some PIs, because some of their students cannot make it, will be able to extend the time of other students graduating, so therefore they can sponsor them and they can do some work, but that allows some avenues to cover. So there are different scenarios likely to happen, but I think this international student and postdocs' ability to access US and travel and come here next academic year can become a bottleneck for several people.
All right, I wanted to summarize, I think, a couple of questions we've been getting in about why are we going through this exercise? What is the intent? How are we going to use these numbers? What is the expectation? I think that lots of different perspectives. I guess we could reiterate the motivation of why Ram and Tanju have both gone through this exercise. And then there's the question of, can this exercise be applied when the time comes for advocating for needs, financial needs, or maybe once that supplemental support comes from whatever avenue, can this then be used as sort of a formula approach to give universities funding? So Tanju and Ram, do you want to talk again about like why it is you went through this, and then talk about maybe how you're using this internally versus like how you could conceive thinking about it in sort of an advocacy perspective?
Well, for us, as I said, when the modify operation and we went to the online mode, of course, the reimbursement of tuition, not tuition, but board and rooms and some costs happened quickly, and also the COVID-19 expenses. Our CFO want to have a better understanding of the overall impact of COVID-19. And that's why, I mean, we have a big athletics program and we have research and so forth. So they ask each unit to make an estimate. Just give me some, and based on, of course, there are lots of unknown here, but also how this will affect different units. And I think any proactive CFO try to see what type of uncertainty that he's looking at. So that was the main motivation for us to start. And I think it gives us some valuable information. For example, we have some lost revenues in different facilities. I mean, like there are payroll on those facilities relying on those revenue streams. And when the revenues are down, so those salaries needs to be covered from some other sources, not just the graduate students and postdoc and so forth. And of course, all these discussion that we had, how we can support graduate student education or faculty time so that they can continue their activities. What numbers we are looking at? What's the order of magnitude? So that's was the initial motivation for us to start this exercise. But after going through this, maybe this might be helpful to aggregate and come up with some kind of an estimate, or the areas that higher education will be impacted from this event. And and I think, as I said at the beginning, for us, this is a work in progress. We at least established a system, and we continuously modify and have some discussion about what type of resources that we can find. So that's how we approach this, basically.
Our motivation was the call from CFO's office was, you know, we were summing up the impact of COVID-19, potential impact of COVID-19 to our state, to the governor's office, actually. So they asked, they know what the tuition losses, revenue losses, and all sorts of things. When they're adding up, they ask, what about research? How much money are we going to be losing, et cetera? But from early on, from the NIH, Mike Lauer's video and NIH bulletins, that there is going to be some form of, there's likely to be some form of supplement. So we just couldn't say that this is a research expenditure and research has stopped to zero. This is a total. That would be naive, overestimation. So we ended up looking at the numbers to essentially do a best case, worst case, to see eventually what the institutional deficit turns out to be. Maybe a legitimate ask from the state to help cover and continue the mission of education. But particularly, I think significant portion of that is likely to be graduate education. So that was the motivation. So first, that's the first part of the question. What is this exercise about? I mean, that's what it's about for us. And in an internal sense, if no one else covers it, somebody else has to get through these students, and this is what the number will be, as opposed to we have no idea. The second portion of the question, advocating for needs, that we have to be very cautious about using this structure. That was in fact the last question we have on the board on the slides, is in fact pointed to that question. If we agree upon a not very granular but sort of a broad set of places where COVID-19 is likely to affect 90% of the institutions and 90% of the cases, it's salaries, we know that. So if we had some standard set of these buckets and we start putting that in, that might help agencies see that they don't need to go project by project, PI by PI, grant by grant, and award $300 and $200 at a time. And increase their workload and increase incredibly the workload of Office of Sponsor Program filing those claims. And there's hope that if we provide reasonable rigor in this process and reasonable uniformity, that we have a sense of what it is, then my hope is that it will be a sort of a proportional supplement at an institutional level that we can actually document and disseminate in the way that we think is appropriate. That's the reason for the question, the fourth bullet on the screen. So, I'll be interested in seeing if there is a value, following that question, is there value in coming up with a standard set of non-granular buckets that all of us put in a reasonable estimate with reasonable confidence and see an overall trend of what might be reasonable that we could get from agency as a block.
And Bethany, I will add one more thing. One thing we learned from this also, we look at our non-federal research side a little bit more closely because of this exercise. I mean, like, especially industry funding, it's not as big as the federal portfolio, but it helps us to go through more detail, the federal, some of the soft points, some of the potential hold or terminations. So, and because of that, our industry contract office is much more close relationship. In our case, we have a couple good-sized grants with some industries and some are critical partners or strategic partners. So we look at the non-federal side as well closely, because definitely for those kind of areas, we need to help the faculty and students, especially relying on those fundings, especially if the non-federal side comes up or continue.
So I wanted to give Carl the opportunity to talk. You should be allowed if you want to unmute.
Hi, everybody. Carl Steiner from UMBC. And first, thanks to everybody for putting this together, and these examples are very helpful. The question that I want to raise is this. Clearly, individual labs, individual researchers, individual students will have very significant financial and personal impact because of this. But institutionally, and the data that Ram just showed matches, I think, what many of us are seeing currently. We have very small deviations from the previous years because everybody's still getting paid. And the real question I have for next year, the chief financial officers will want to know, what is your research budget and your F&A recovery budget for next year? And my question to the panelists is this: the 2008 era stimulus money at the time brought very significant, I'm going to use the word windfalls for the academic community. And there's clearly a lot of push currently in Congress to the CARES and other programs to also provide significant research money back into the community. So do you think that would offset or maybe even increase the research expenditures for next year, despite the fact that we will be at home?
That's a very good question and comment, Carl. I mean, here's what I'm thinking. All of this calculation assumes that we're going to deliver on the list of deliverables agreed to, and we are going to be short of money, right? So if the new infusion of funds to agencies for, I mean, in those times, if I recall, it was shovel-ready projects, you were funded. If the PIs worry, the worry that I'm hearing from the PIs is that, okay, I'm spending money without paying people without work, and then I'm accountable for the deliverables I put on my grant. So that's why I need this money. But if the agency says, okay, whatever you did is what you did, that's the project, finish up. And then you have this new infusion of money across the board, not only COVID-19. That's the worry. The money could all be in COVID-19. And these folks who have nothing to do with COVID-19 research will be, we may end up with not that windfall that you're talking about. So as long as the infusion is to raise all boats in academia and have this increase in budget in every program, every discipline by X%, and then COVID-19 a disproportional percent is warranted. And then if you cut short these projects, so we don't have to worry about shortfall on these projects, because we worked as far as we were paid, and we got paid for some work, and that's the end of story on that. I mean, I could see that scenario brewing, and that could be a win-win if that's an approach carefully thought out and put in place.
I agree with that. If the additional funding is not limited to COVID-19, then I think it can have positive impact across the board. But if it is limited and linked to COVID-19 or pandemic or health research, then of course the impact will be only limited to a subset of disciplines of those kind of fundings that Carl is mentioning.
So I want to comment on that. So I too agree with that. I think there's a potential benefit from the new funding, but there are two things that are not going to be replaced right now. One is the time, as we talked about, and some people may have certain limitations on whether that can be made up with money. The other one, which it was one of the questions actually, is the impact on different groups. We talked about whether you're in COVID-19 or not, but we already have some indications that the stoppage and this whole episode is affecting either underrepresented minorities or female faculty more, both in terms of submitted articles, manuscripts, as well as some of the other areas. So I think there's another angle to all of this, or another thing that the institutions have to do themselves, which is to adjust either the expectation or the timing on some of the promotion, tenure, and other things, because even if the money comes in a little bit later, but someone still has to take care of a child, for example, because certain facilities are not available, or during this time where some people are working, more hours actually, but others are not able to. So I think we should keep that in mind as we develop our strategies forward.
Chaouki, you bring a good point that, of course, CFO's office also worry about the cash flow. So therefore, if we get the money and then we do the research, recover FNA, then there will be a need right away in the fall or in the spring. And do we have the cash in hand to cover those immediate needs? So that's, I think, another driving force there.
Yeah, that's an excellent point. The cash flow issue, even as we ramp up, the material losses and things that I talked about that potentially they'll be reimbursed from the government, I don't think it's going to be timely. The next 2 weeks, we're not going to have supplement at the door. So that's another question that we are trying to address. How much of, I don't know, this will be a curiosity question to all our colleagues online here, is institution, I know all of us are strapped, but institution, the position to set aside a bit of money that you actually know that you will reimburse later to get research started soon enough. Is there such a need? We are wondering about that question.
Yeah, so Chaouki was referring to Terry and Bernard's question about these groups that we want to make sure we are aware of during this time when we talk about productivity. I wanted to offer Terry or Bernard, if you would raise your hand, we can call on you to go into more detail with the question you asked in the Q&A. So if you'd like to go into more detail, let me know. But I've also heard thoughts with regards to this question about the underrepresented groups, or thinking about any disparities. Back before the pandemic, there was a way of thinking about how we would reach out to these groups in a more meaningful way as they may be going through their research career or applying for grants. And the conversation came up at one of the science agencies about having a special fund or something set aside at this time. And is it something that you're thinking about, Ram and Tanju and Chaouki as well, about setting aside something specific because you are tracking and aware of what's happening on your campus? So some people, I think, are definitely more aware and are able to track as well what these financial impacts could be on these groups. So are you thinking how you go through that, or have methods and ways of tracking or sharing, saving funds for these specific groups?
Bethana, we haven't come that depth of the discussion or thinking about this thing, but definitely, I mean, our approach has always been, okay, where are the most needs are? I mean, that's of course is important, but we acknowledge those groups need special attention. So And that will be a combination of what kind of needs, those kind of support that we can provide, and versus how much resources available. So, but we haven't had, I mean, too substantive discussions or financial thinking about how we will do that. The first thing for us, keep people safe, healthy, and who are the most need that we need to be able to address and support those needs. Of course, COVID-19 research, anyone trying to address and so forth. So they have been on the priorities so far, but hopefully it's gonna come that point that we can be a little bit addressing those groups as well. So that's where we are right now.
I think I view the question as, you know, under circumstances of you know, caring for a child and whatnot, you expect that it's possible that the productivity would be lower than someone without those constraints. And taking into account and providing additional support for those types of specific needs is something that we will I mean, from my office, we certainly would consider. And any discretionary money at all, if there's such a thing called discretionary money, I think you can always prioritize. The intent is to prioritize for these types of expenditures. So that the institutional portion that I talked about as a bucket of you know, lost productivity that's covered by no one, that institution has to think about, that bucket actually in a way would capture this expenditure. And being able to support that going forward to get the same level of productivity is something that the intent of the institution is absolutely there. And the means is something that we have to secure and prioritize. Bottom line is there is always money, it may be small, but you have to prioritize for this. That's the important part.
Yeah, and so I'll call out also some of the things that are coming up in the chat. Melanie pointed to an Inside Higher Education article that the headline is "Journal Submissions Suggest that there is this data already on the tanking women's research productivity." So we have about 10 minutes left, and so we'll ask one more question, and then we'll let the panelists moderator also have their last few remarks. So one of the questions from Faith, can the model be adapted so that estimates of loss are discipline specific? Would this be worth the administrative effort to do? So if the panelists would want to respond, and then we could also get responses from the audience.
We can go that.
In fact, I'm going to say that Tanju in his slides had agency specific. In fact, agency has a different characteristic, NIH versus NSF. DOD, I mean, if you can do, because you easily, your accounting system tags by agency, discipline is a tough one because, you know, you may do nanotechnology at NIH or DOD, and how do you code that into our system? I'm not knowledgeable enough to know those details, but I think the school has, you know, schools have distinct characteristics. So when you do PI surveys about, I already know that the graduate student loss is significantly higher in engineering and in arts and sciences relative to School of Medicine, for example. So we can get those characteristics based on the type of research that you can say, you know, the basic sciences, and then social sciences is a different, you know, bucket altogether when you look at School of Public Policy or School of Education. You know, their work stoppage is several of that is seasonal. When schools are closed, they can't go do education research. So, and that's a different bucket. So you could sort of, at least I would think about, and we have 12 schools. I don't think, it could be school specific, but then some of them are logically combined, business and commerce are combined. So I would say about 6 buckets is what I'm kind of arm waving here, but 6 buckets is, I think it's possible to group into general characteristics of disciplines. I think it's possible with the current data set.
In our case, we also look at the expenditures by colleges. So in other words, we have a reporting to our board of trustees periodically. So therefore, we can divide the data in terms of especially the agencies and so forth on a college basis. So therefore, we can figure out the payroll from colleges. I think for other parameters that it may be possible to link to colleges, not discipline, but for colleges. And from there, I think maybe it can go more granular, but we can divide for college-based estimates.
Okay, thank you. Again, if you have any responses or if you want to raise your hand, we can turn your mic on and allow you to talk. If there are no other thoughts or responses, I wanted to give Chaouki and the panelists the last few minutes to wrap up your thoughts or what you think you've learned.
Okay, so why don't we start with Ram at this case, and then go to Tanju, and then I'll have a couple comments.
Okay, first of all, thank you, and great questions that will help shape this thinking further as we need. Again, we don't want to over-engineer and calculate all of these numbers. We only calculate to the extent that is needed. But again, I'll be interested in a standard set of expenditure buckets. I'd like to kind of get a sense how things are going, other institutions where we are. The leaving note here is, as much as we talk about ramp down, ramp up, and then this financial implications, it's very important for our PIs to know that they're not alone dealing with this. We are behind them. We are actually thinking for them. We're losing, not getting enough sleep, rightfully so, on their behalf, and perfectly happy to do it. So, and as APLU, as an organization, we are lobbying, we are really advocating for the ideas that that I think our lawmakers should know. So I think the PI should know that, because what I worry about is this sense of, particularly with this social distance, sense of loneliness and kind of burnout of our PIs. When they come back, they're so tired thinking about all of these things on their own. Just want them to know that there's many people, agencies and organizations like APLU thinking on their behalf and in their interest. So I just want to send that message out to PI, our institution. I'm sure it is true for everybody else. I'm just speaking on as a VPR to faculty. Thank you very much for the opportunity.
Yeah, I will also thank for this opportunity, and really the biggest benefit of this exercise for me as VPR to learn much more about my institution, about the need of my faculty, because my job is to help with their career, with their research accomplishments, and to understand what type of challenges that they are going through or they might go through, and also how I can be helpful and across the university. So seeing some of, this is not just number crunching exercise, but looking at some of these numbers give me some perspective and to better understand how I can be relevant and helpful for their needs. And as Ram and Chaouki, I think, is indicated that this exercise and this event, all the unfortunate, really brought us much better together. And because at the end of the day, we need to go together, all these challenges. We can always, have disagreement or different opinion is all fine. And that's usually the philosophy that I am trying to promote at my institution. I share the information and I'm looking ideas and good ideas from smart people. And at the end of the day, try to be helpful the best I can. And of course, while doing that, I'm providing information to CFOs and so forth, so that because I understand the challenges that they are going through to keep the institution still stay strong and so forth. And also, one thing I learned, solve some very difficult problem as fast as possible, because some of the things that we face throughout this crisis, probably we will take months to study and so forth, but some of the questions and some of the issues come up require quick answers. So that was that was lots of learning experience, but I'm very pleased the way that our faculty work with the administration and help us to go through together. So, and that's how I would like to keep. Again, thanks for everybody for your time. And also, please feel free to communicate me. I'm always open to good ideas, and I don't mind stealing other people's ideas.
Well, great. Well, thank you both, Ram and Tanju. I learned a lot. For example, I just learned that Clemson has an athletics program.
Yeah, small one.
For example, that's great. Yeah, very good. But really, what I wanted to leave us with is thanks to the panelists, to Tanju and Ram and everyone else who asked the questions. But I want to ask a question about, do we have any opportunities going forward? And here, what I have in mind is the way we responded as research enterprise at universities. We responded in a way that I think basically bought us a lot more time or a lot more goodwill in terms of what research institutions contribute. So although we cannot sustain the pace that we're working at, I think maybe after collaborations that came out of this, including collaborations across institutions, but also between institutions and civil society. I think that's something we can take, and hopefully we can build on that, maybe propose centers or different ways of trying to get some funding that we can all be successful at. So with that, I want to thank you. It's been an honor to be part of this discussion. Have a good afternoon. Stay safe. Stay healthy.
Take care, everybody.
Thank you, Bethany. Thank you very much, and APLU staff for a wonderful event. Thank you.
Thank you, Bethany.
Thank you. Proud to be a Clemson alum.